I'm going to demonstrate some of the stretches you can do if you have cervical spine tightness or pain. So the most basic and easiest stretch to do that'll help alleviate the pain for a lot of people is just the upper trap stretch. So what you're going to do, you want to hold on to something with the arm on the same side as the muscle being stretched. So if I'm stretching my left side, I'm going to use my left arm to hold on to the table, the chair, wherever I'm sitting. My right arm is going to go over top on the opposite side and gently pull down towards my right shoulder. And you'll feel a stretch on the side of your neck all the way down into your upper trap. Another stretch we can do for the levator scapulae, which is a muscle that attaches onto the top of your scapula, it can be very tight in a lot of people, especially those with desk jobs. We're going to take our head and look down and towards our opposite armpit of the side we want to stretch. Now with our hand on the side of the muscle we're trying to stretch, we still want to hold on to the table, the chair, whatever we're sitting on. Now you're going to reach over to the opposite side of the head and pull down gently. Now you can play with the stretch a little bit depending on whether or not you're feeling it. If you're not feeling the stretch as much, you might try rotating a little more and looking this way and pulling down. Another stretch that we can do for the suboccipitals, or the muscles on the base of our skull directly in the back, is a shoulder retraction stretch. A cervical retraction stretch. So with your hands clasped on the back of your head, you want to try and make almost like a double chin, press your chin back and down and apply overpressure. So you're pulling down and in on the top of your head just gently, and try and bring your chin to your chest by pulling down. And you should feel a stretch on the back side of your neck. For the scalenes, which are muscles on the anterior and lateral side of our neck, what we're going to do is take our hands, press them over our collarbone. We're going to extend our head, tilt to the opposite side, rotate, and then allow your head to fall back more. And you should feel a stretch all the way down your sternocleidomastoid and your scalenes, which are the muscles on the anterior and lateral side of your neck. So those are our cervical stretches. Another option we have for cervical pain is what's called snags, which are just sustained mobilizations with pressure. So you're going to take a towel and you want to put it right on the spot on the back of your neck that's causing you pain or discomfort. And this shouldn't be painful while you're doing it. And your direction of pull is going to be up and towards the eyeballs. So you're going to do this with motion. So if we're doing this for extension, you're going to look up towards the ceiling and you're going to pull up and towards the eyeballs, hold for 2 seconds, and then relax back down. You're going to repeat this up to 5 times at the same level, depending on if you're getting a reduction in symptoms. And if you don't get a reduction in pain, you can move up to another level. So up a little bit higher on your neck or a little lower, depending on where you're feeling it, and repeat that. You can also do it with rotation. So if I'm going to look towards the right, I'm going to pull my right hand over to grab onto the towel and rotate. So this hand is just stabilizing. My right hand, if I'm rotating towards the right, is the one that's pulling, applying the pressure. So when I rotate towards the right, I'm going to pull with my right side to apply pressure. Just like that. And if I were doing it to the left, it would be the opposite. So my right hand would be stabilizing, and if I'm rotating to the left, my left hand is the one applying pressure. Just like that. And that's what's called cervical snags.